In a chronic situation, the ligament has withered away. This technique will be with use of a tendon graft. We're releasing the adductor aponeurosis. The joint's now exposed, and you can see there's no ligament left other than a little bit of ligament on the metacarpal head side. I'm holding the adductor aponeurosis there because we know we want to fix that later. Here we are putting our anchor in. It's called the trushot with Y knot. Drill in, drill out, tap it in, and deploy it, and you're done. There's our first anchor. We're putting our second anchor now. I usually put the anchors in before I bring the tendon graft to the operative area. So now we have both anchors in position and we're ready for the tendon graft. So here we go to the wrist. Identify the tendon through two little incisions. Obviously, be very careful you don't get too deep and harvest the median nerve. There's your tendon. Now you have your tendon graft weaved through the ligament stump at the metacarpal head region. So there's a mattress stitch placed into the metacarpal head of the entire complex. Once again, the graft is pulver taffed through the remnant on the metacarpal head, and we're going to tie these knots. And now we're going to take our ligament stump, palmaris longus graft, and we're going to bring it now to the proximal phalanx. And I want it to be fairly snug because it will loosen up a little bit. So I want it on the snugger side. I have my assistant ulnarly deviating the thumb as I tie this because I know it's going to stretch a bit. And we'll complete the procedure by repairing the ligament complex to capsule. It's a good construct. So the adductor aponeurosis is the last thing that has to be repaired. We apply a thumb spica splint in the operating room. At 2 weeks, we usually convert it to either a splint or a cast, depending on the reliability of the patient, and we start moving them at 6 weeks. Most patients are doing pretty well by 8 weeks, but I typically tell them not to do vigorous activity for about 3 months. But I have stretched that to 6 to 8 weeks in some circumstances and have held up pretty well.